Well, you should know. You've got me in here for a week.
This is true. This is true.
What more can you do to me?
So I'm gonna just take some bottles real fast, okay? Stick this under your tongue for me. .2. And I'm gonna get a blood pressure from you, okay?
Okay.
So Charlie, have you had any cough or anything recently?
Well, off and on.
Off and on, okay. And how is your leg pain doing? You can rest that.
As bad as it always been.
Yeah, on a scale from 1 to 10, what do you say it would be?
9.
Okay. Are you still pretty short of breath?
Whenever I get up, yeah.
Okay.
I'm okay in the bed.
Did you order some breakfast yet?
No, I don't like the food here.
Yeah. So your blood pressure was 151/75.
Is that good?
That's a little high. That's why we got you on those blood pressure medications. I'm just gonna stick this on your finger, okay? And that's just looking at the oxygenation level. Looks like it's at 92. Thank you. Charlie, looks like you're breathing about 30 times per minute, okay? It's pretty fast.
Okay.
Do you
What does
feel
that
like
mean? What is that? Is that bad?
it's pretty fast. Usually it's no more than about 20. It's just because I think you're a little bit low on oxygen in your body and your body's trying to get some more in there.
That's why you put this on.
Yep, that's why we got the
Okay.
nasal cannula on you. We sure do. So do you mind if I do a bit of an assessment on you, Charlie? Is that okay?
Yeah,
Okay.
sure.
And just look forward for me, okay? Can you follow my pen with your eyes? Looks like you're having some trouble on your left side. Is that from your Bell's palsy?
Probably.
Yeah,
I guess it is.
okay. But you've had that for a while.
Yes.
Okay. Can you feel me touching you?
Yes.
Okay, good. Looks like your skin is a little dry up there.
Yes, I guess it is.
Some of the nurses were telling me that you've been complaining that it's like kind of catching on some stuff and it's a little rough up there. Okay. I'm going to listen to your heart a little bit, Charlie, okay?
Okay.
Sounds like your heart's beating about 77 times per minute, okay?
That sounds fast to me.
It's not that bad. It's in normal, so you're good there. But I did notice that I could actually see your heart beating right here. We call that a little bit of palpitations. I noticed that a little bit.
Really?
I did. So Charlie, does it hurt when I squeeze it here?
Little.
Little? How about here?
That one's worse than the other side.
Okay. And I heard you've been having a lot of leg pain. You haven't been able to move them much.
Yeah, it's true.
Okay, okay. I'm gonna take a look at your feet. Is that okay?
Sure.
Your feet look a little dry and a little swollen.
Was that part of that other stuff?
Yeah, it is.
Okay.
And also, you know, you've been in the bed for quite some time and not been able to get up,
Yeah.
so that doesn't help either.
Okay.
So that's why we're trying to get you better enough so you can start walking.
Well, that'd be nice to be able to do.
And this leg looks dry too, but you do have some scabs over here, so we'll take a look at that later.
Okay.
Do you mind pushing on my hands and the other way? Good.
That's something good I did?
Oh yeah, it's very good.
I wish I could do that.
Yeah. Okay, Charlie, I'm gonna take a look at your lung sounds now, okay?
Okay.
I'm gonna have you take a deep breath for me when I place my stethoscope on your chest, okay? Great. I'm hearing a little bit of crackles in the bases of your lungs, Charlie. And I think that might be from your congestive heart failure and then sitting in bed so much. So we're gonna try to watch that and make sure that that doesn't get worse, okay?
Okay.
And I'm just gonna palpate. Is it tender at all?
Yeah?
Right here? Okay. Have you been able to pass gas at all?
No, I don't know. I don't think so.
Okay. And I heard you haven't had a bowel movement for about a week almost.
Seemed like a lot longer than that, but
Yeah.
yeah, that's probably right.
Okay, we're gonna try to get you some stuff ordered so that we can take care of that, okay?
Okay.
Mostly drugs that'll just help you pass some stuff. It's not gonna do anything crazy. And then I'm just gonna take a look at your capillary refill. I'm just checking to see if you're having good blood flow to your fingers. Looks like that's good, but you do have some edema in your hands, so your hands are a little swollen.
Is that like my feet?
Yeah, it is. Okay, Charlie, so I think I'm done here. And I'm gonna leave, and then I'm gonna go get some stuff, some of your meds that you need, and take care of you. And then if you have any questions, just let me know, okay?
Okay. Thank you.
You're welcome.
Hi, Charlie.
Hello.
I am Dr. McDaniel.
How do you do, doctor?
Good. I just spoke with your nurse, and she was talking to me about some of the things that you guys discussed. She was telling me you had some swelling in your hands, a little bit, and some crackles in your lungs.
Yeah.
And you have, how long have you had high blood pressure?
Well, a long time. Every time I have it done, they say, "Ooh, that's high" or something.
Mm-hmm. Have you been on medication for that?
Yeah.
Okay.
I take something.
Okay, so do you have any questions for me regarding what you talked about with the nurse?
Yeah. The other nurse who was in here poking and prodding, she says I have heart failure, and I thought if you had heart failure, you're dead.
Well, not necessarily, but after a long period of time when you have high blood pressure, that starts to put pressure on your heart. So then it's harder for your heart to pump the full amount of blood out into your body. So then after time, your heart gets tired and it's harder for it to pump, and then it keeps digressing like that until their fluid backs up into your lungs, and that can become a problem. Also, it can affect the way that your kidneys get blood, which they need blood to filter out you know, the toxins in your body. So if the blood can't get out of your heart, then it can't get to your kidneys, and that can affect your kidneys and other parts of your body as well.
Well, that makes sense, because
Mhm.
everything else is sort of connected again.
Yeah. Okay, so we got the results back from your cardiac exam, and the results showed some thickness in your walls of your heart, a little bit of left ventricular hypertrophy, which means that the pump on the left side of the heart, which pumps the blood out to the whole body, is a little bit enlarged, so therefore it takes a little bit more strength to push stuff out. So that's why some of the fluid is backing up into your heart there. And then some aortic insufficiency, mitral and tricuspid regurgitation, so those are the valves that the blood must go out before they go into circulation. So they're not working as well, so then the blood gets stuck in there.
What was that again?
Mitral and tricuspid insufficiency.
I didn't even know I had one of those. So.
Yeah, so if if the flaps aren't working as well, then the blood can kind of stay where it's supposed to come out of.
Okay.
Okay, so do you have any questions for me regarding what we talked
No,
about?
I have a lot of stuff wrong, apparently. I couldn't have any more stuff, I don't think. No, I really don't. I think you answered a lot of stuff that I didn't want to hear, I suppose.
I'm going to go talk with your nurse, and we're kind of going to make a plan about what the best care for you is.
Okay.
And then after we do that, we'll come back in and talk to you about that.
Okay, fine.
Okay.
Thank you.
Thank you.